All right, we have Dr. Joe Landers here to answer your questions, and he's brought along a friend this morning. This is Little Bear, right?
It's okay. Is his Little Bear. He's a little nervous right now, kind of shaking, but he's
shaking a little bit.
He is. He's kind of a shy little guy, but once he kind of gets comfortable, he gets a little bit more at ease or whatever.
He was found at the dollar store.
Yeah,
so we know he likes to shop.
Absolutely. That's right. We should call him Dollar or something. But he's grown a little bit. You were asking me how big he'll be, and honestly, it's anybody's guess what's mixed with him. He probably has a lot of mixture in him, but you know, he's getting kind of longer, and I don't think he'll be, you know, I think he'll be 40 or better. But he's over at the Animal Aid Adoption Center, which is 918-794-6688, or animalaid.org on the net.
Animalaid.org, or again, what was the number?
794-6688.
All right, so that's where you can find a Little Bear. Let's go to the phones. First up today, I believe we have David. David, are you there?
Yes, I am.
Hi.
What's your question?
Yeah, we got my little scooter dog. He's a Brooke Welch Corgi. He's got a lot of fluid in his ears all the time. And he's always shaking his head, and we've cleaned him out and put some Q-tips and tried to be gentle with him and everything, but he's always shaking his head. And I can rub his ears with a lot of fluid.
Sure. A lot of times, and that's an ear infection, and it's pretty chronic, it sounds like. And there can be some underlying causes for chronic ear infections, and that's one thing you want your veterinarian to look down in there. Probably needs to be on some type of ear drops that will kill off some bacteria and yeast. A lot of times those get in there. Some of them can have some ear mites and stuff too, but most of the time you need to kind of have someone look down in there. Cleaning out is a great thing because you're at least keeping kind of level there a little bit, but most of the time until you direct it at the underlying cause. And a lot of those are allergies. A lot of times I've told people we've treated ears with much antihistamines as we have with ear drops and stuff. So have them looked at because that can be, you know, it can get worse. So
let's head out to Glenpool and talk to Judy. Good morning, Judy.
Hi.
Good morning.
Hi.
What's your question?
I have a 14-year-old Siamese cat. And she weighs 10 pounds.
Oh, good.
I adopted her when she was teeny tiny baby.
Yep.
My problem is she cries like she started this 3 years ago, just crying or saying mama or saying, you know, got real
If you'd like
talkative.
to make a call, please hang up and try again.
Uh-oh.
If you need help, hang up and then dial your
Having some
operator.
trouble with the
anyway,
phones there, obviously. Did you get the gist of the question?
I got a gist of a question. Now, what I'll tell you is 14 years old is very old. Usually 10 to 12 is an average. Sometimes they cry for different reasons when they get older like that. Going on for 3 years, Siamese tend to talk a lot. When we adopt out Siamese, I'll say, hey, this cat's got you know, a lot of them are very vocal. It's not bad or good. It's just they're trying to talk to you, and of course we don't talk cats. So sometimes you can tell what they want, sometimes not. Other deals can be if they have like some chronic pain or something, have some arthritis or other deals. She probably needs to talk to her veterinarian and see when it's happening and if they can associate anything with it. Or it may be some old age and a little bit of dementia there where they start just kind of wandering and talking. That's a very common sign. That does happen from time to time because you can't ask them what day it is and who the president is. So.
It's kind of tough, isn't it?
Yeah,
so could be okay, but take her to the vet to have her checked out. Thanks for coming in.
Well,
we
you're
appreciate
welcome.
it, Dr.
Thank
Joe.
you.
Well, still